Good evening, everybody, and welcome to Taylor Tuesday, July 20th, 2021. And it is a wonderful day. I'm just glad everybody's here to join us. We've been doing this for quite some time. I'm got my new co-pilot tonight, Ms. Ashley Watkins, our Director of Sales, and we are grateful to have one of our uh, vendor partners, um, HillTop, who was actually an unbelievable asset during COVID when COVID started and people couldn't get hand sanitizers. They were actually our first vendor to be able to help during the pandemic. You all might remember that we started doing this during the pandemic as a way to just help people kind of figure out maybe some processes and procedures in their practices that would help make them better. So we've continued doing that. We did cut it down from weekly to twice a month. We call it Taylor Tuesday. We do it the first and third Tuesday of every month, and it's just been something that really is, I would think, is a labor of love. We put a lot of work into it because we want to try and help our practices and our members provide great outcomes for their patients. So I'm going to tell you a little bit about Taylor. I don't normally do this. Dr. King normally does this, so I'm going to do the best I can to fill his shoes. Um, One of the most important things that I would like everybody to know, and that we want everybody to know, is that all of these webinars are recorded. So if for some reason you don't have the opportunity to watch, if for some reason you feel that the information is going to be beneficial and helpful to your staff, all of these webinars are archived, and you can go to the upper right-hand corner on our website, which is www.taylormedical.com, and click on webinars, and in the upper right-hand corner, and all of the webinars are archived for you to be able to play again for yourself and to um, share with your staff, or even again re-educate yourself on something that you thought was helpful but you didn't remember everything. As far as Taylor goes, I think that for those of you who have taken advantage of Taylor to its fullest benefit, we are not just here to get you the best price on a piece of gauze. We are here to help you in your practice. Yes, we would like for you to save money, but we also want to help you how to add um, different sources of business to your practice, ultimately to help your patients. I look at it in a variety of different ways. I think that for those of you who realize we are not just physicians, we are in the business of practicing medicine. We need to make sure that not only do we take care of our patients' health, but we take care of our practice's health. And that's where Taylor comes in. So I can tell you right now, on everyday products, I would suggest that you do a free cost analysis. We don't charge you anything. You just have to give us a list of your products. Some of your vendors already do Excel spreadsheets. You can easily download them and submit them to us. If you don't have that, for other vendors, you can give us copies of your last few orders or invoices. And if that doesn't work, give us an Excel spreadsheet. Most offices at least have an ordering list of supplies that they do. And what we would do is do a free cost analysis for you, and we'll tell you apples to apples, if you use the same products, what that cost would be, or what I call apples to oranges, we may have to replace it with a branded product from one of our other vendors. So that's an opportunity for you to do things. I think what's really interesting when you think about what Taylor is here for, Taylor is here to, as I said, help you implement new things into your practice. And I was just having a chance to discuss with our speaker tonight, Michael Johnson, who is a partner and business development specialist for HillTop. He has 10 years of protocol in development of integrating retail products designed for the healthcare space. And I think what Mike is about is developing some real life solutions and to try and get you measurable outcomes with your patients and increase cash revenue for your practice. So it seems like Michael's expertise is exactly what Taylor has been looking to do when we started these lecture series, is to provide you just that. So without further ado, I am going to turn the program over to Michael, and I'm looking forward to hearing what he has to say. And Ashley will be on. And as always, please don't hesitate. If you have any questions, please put them in the chat box, and we will make sure that all of these questions are answered. Michael, it's all yours.
I appreciate it. Everybody can hear me okay, I'm guessing. Ashley, we're good. Let's see. All right. Thank you. Yeah, and I want to kind of build off of what Dr. Cross is saying, is that one of our essential efforts and what we've been doing for a long time is looking at how we can actually create purpose into just carrying more products. And a lot of medical clinics might bring in specific types of products that they believe are going to be such a benefit to their patients. But one of the most difficult things we continue to see is you do see this challenge of creating purpose in what you're really trying to accomplish, or getting a patient to actually visually see it, and how do you answer questions quickly without adding more time, obviously, to the clinical space. So there's a lot of challenges that come along right now with CBD, and they essentially hit a lot of this. So what we've looked at as a company in the direction, if you have done business with us in the past, or if you're looking at doing business or carrying CBD now, or looking to bring in a natural approach within your practice, is that we are looking at making these very simple approaches to improve outcomes, first and foremost, utilizing hemp-derived CBD. And the thing where it comes from is it's not about the product. We're going to talk about actually the development of protocols and how it actually attacks these specific challenges. So over the years, the last couple of years, CBD has really come to light. It's been very, very large out on the West Coast, and it's spreading rapidly across the country, and how patients are not only looking at new alternatives, but a lot of them are going out and seeking them themselves. So they are already searching for this kind of stuff. And unfortunately, they're ended up at places that we believe within the medical space, a lot of physicians that we work with believe it's better to have it come across their desk and within their practice to delegate and give some type of ideas and responses on how they can approach specific types of concerns and chronic illnesses, even when it comes to looks at pain and sleep and stress, which was the primaries of what we're trying to help with. So patients are not only searching for this, but they're looking across the internet, and always, again, the medical space is by far the best realm of getting the right information. So how do we reduce the stress of offering CBD, answering the questions, but most importantly, understanding how to use it correctly, dosages, what am I getting out of it? So again, with protocol development, we're looking at how we can create purpose within the actual effort of our products, and where does a patient go with that, and what are those outcomes that we're obtaining so they become measurable, they become very predictable. And then also, how do we do this within a cash day of service revenues and improving that? And most importantly, what we're starting to see is how do we not compete against the actual medical space or the physician's offices? So HillTop has looked at all these massive challenges and how we're going to address them. So first and foremost, we know within the actual space, and a lot of studies that are coming out utilizing hemp CBD, is that CBD does work, and a lot of response we're getting back from patients, it's very strong, and it's becoming an alternative or a combination with medications. So we could get into the opioid discussion and other remedies that have been used in the medical space to address pain primarily. But how is CBD working, and what are the responses from it? And it's becoming a very effective way to address these concerns. And most importantly, how it's stacking up is that you're finding out a very large amount, or finding it through utilizing hemp-derived CBD. And we're going to talk about the differences. If you're not familiar, there is a massive difference between marijuana and cannabis CBDs and then hemp CBDs. There's a big difference between the two, and we'll kind of cover that also. So we do know that they're stacking up against prescriptions as a very natural remedy, supplementation effort that can be used. The question comes is, how do I use it? What's the best way to use it? How do I structure it? How do I make it simple? And that's what we're going to come in play and looking at what users really utilize CBD for first. And most importantly are these three top ones. What we're seeing is in pain, stress, of course, anxiety and insomnia. And stress and anxiety, as you know, and this is being touted more and more within the industries, is that how to address the post-COVID situations in regards to stress. And this is becoming a very, very strong approach into that. So, and again, we get into, of course, products online and how they're labeled and then the federal regulations. So there's a lot of that I want to cover, but most importantly, that there's a lot of mislabeling out there. So we're going to talk about the importance of how we can bring that to the table to you as a solution, on how we can actually give you certified type products. So you know you're not only following federal regulations, but you know exactly what you're giving your patients, and your patients know exactly what they're getting from you. So we're going to address those types of challenges too. So within these solutions, the biggest thing is that we are looking at condition-specific design programs that achieve results utilizing hemp CBD, making sure we provide you organically derived, very high, pure, potent type of products that you can trust, and obviously the patients are going to trust coming from the medical space. And then how do we make this simple for you? How do we make it easy for you to talk to patients? How do we make it quick? How do we get them started fast? And how do we improve the amount of patients that are going to come back and continue to use it? But most importantly, give you the reviews and the feedback and the outcomes that we know we're going to get from it, so you could utilize that within your practice and however you decide to use it, right? If you were either internal clinical studies or just a way to influence more patient base. So we're going to look at all of this and structure it so it's simple for this to happen without adding more time to your practice, but most importantly, adding cash revenue. So HillTop is essentially the very first recognized in healthcare by combining easy to follow, structured, dedicated protocols, mainly on these three main ones. We're talking about pain, sleep, and stress. There's physician oversight built within this. We do not sell direct to the actual patient base. It has to go through a physician's office. We look at safe, natural approaches. And of course, we are outcome focused. We want to see actual improvement within patient care and the patient results, which we know through the physician office is the only way to obtain that. So why us? We essentially provide patients with a simple CBD program. It is designed with safe, natural condition specific formulas. And we're focused on outcomes. That's the primary of what we're trying to achieve. Is we want to see improvements in pain. We want to help with stress, and we want to help with sleep. So just to give you kind of reviews, I think this is important because since we're so focused on this, we are the amount of reviews that we're starting to obtain from real patients, and these are coming from physician offices. It's been extraordinary. And it's not just the product, it's how they are laid out and utilized, how they're in combination to the specific concern, how long they have to be on them, the dosages. The goal is making it simple so they know where they're going with it. Again, we're creating purpose within the programs. And between the pain and the sleep, as you can see, we're even, the previous is we're working with Olympians. It's a really amazing where this is starting to lead within the physician offices. So kind of give you a taste of what people are saying. So we're improving compliance and efficiency and making it easy for titration, but most importantly, creating purpose. So we're making this very effective programs that address all these variety of issues. And this is what we want to look at. It's not just pain, it's also inflammation, insomnia, and so forth. We want to look at making it simple for you to, as a physician or a clinic, to address a patient's concern, giving them the right program to obtain a specific result, how long it can take, what it's going to cost them, and how long, what it'll be entailed in obtaining that outcome. And we want to make sure that's very clear and measurable for you. So we do this in design protocols, and the protocols are very specific. As I said, right now, the three primary focused are the pain, sleep, and stress. And they are very laid out. These are carried within the office. The protocols are step by step, typically more in 4 steps. We complete within self-assessments within the programs. The combination of against that assessment, what products and dosages to take, but also giving the ability for physician oversight so you can create titration and adjustments to that. But most importantly is with most physicians we're working with or finding out is that they obviously combine this with other items, right? It's kind of like with sleep. You can tell somebody to take melatonin and take some CBD to try to get best sleep, but if they're consuming a large amount of alcohol or not getting the right exercises or even down to breathing exercises in a day, they're not going to obtain that. It's not just the product that produces the result. And then, of course, the combination of the protocol to have it laid out specifically. That's what we try to do, is make it simple so it's staged out. And we then focus on the quality of products. They are non-intoxicating, meaning is that we are federally regulated and we are an FDA OTC approved facilities. And what this means to you is that we can provide you certification results on understanding of exactly what you get, COAs. So not only do you fall within the regulations, which I'm going to talk about in a second and what those are, but you know exactly what you're giving your patients. We're the only one in the industry that is doing this through a COA certification process that we call dirt to dose. How do we pull it from the organic levels within the United States, actually Kentucky and Colorado, and why we're called HillTop, we pull it from the tops of the hills. It's kind of like wine if you're a wine connoisseur. It works the same way. The better the dirt, the better the top, the better the product. And we pull this from a very high level, organically derived sources of hemp. Then we extract that CBD and we do triple testing on that to ensure quality, but also toxicity. So we look at different ways of then turning them into oral options and topical options, which then can be used as singled items depending on the type of approach. Like stress, you're essentially going to be taking an oral, but topicals could be in combination of multiple topicals, but also topical with an oral, and sleep falls in the same way. So there's ways to combine these, which we have found out through our physician medical advisory on how to utilize these correctly to obtain the outcomes that we're looking to achieve. So the patient assurance is the biggest thing that we provide to you that you can provide to your patients. And this is both available to you and patients at the same time. Each and every bottle or unit that we sell to you to be sold to patients, it comes with a certificate of analysis, and it can be updated, it can be checked or pulled at any time through our website system or provided to you if you want to do it as a handout. We do all this through our 5-time testing from dirt to dose, as we talked about. And an example of COAs I can send to you if you want to see what they look like. But this is one of our assurance programs to ensure that you are falling within the regulations of the federal government. Now, what is that? In 2008, the federal government had approved what's called the 2008 Farm Bill, and that allows hemp-derived, not cannabis or marijuana-derived, hemp-derived CBD to be used within the actual industrial space or commercial space and medical space without getting an actual cannabis license. The hemp CBD extraction has to fall in one, it has to be derived from hemp, and two, it has to fall under the federal regulation of THC levels, which is 0.03% or less. So through these verifications, we can assure you that you are providing not only a federal regulated product to your patients, but your patients know exactly what they're getting. So it's either 0% and as high as 0.03% in regards to the toxicity. So there's no toxication effect. Essentially the THC, which is the hallucination part to it. So we assure that through that. They do not receive this going down to the local dispensaries or smoke shops, which is essentially what most providers are reporting back as the problem. They see continually patients want to try to find natural remedies, and then they're going down to local dispensaries or smoke shops, and they don't obtain these certifications. So they have no idea what they're purchasing. There's no certification to that at a medical level, and we don't have the ways to actually show the purity or understand there's either an over-the-counter or an FDA certified facility behind it. So that we provide to each and every one of our products to each one of our physician offices. So our promise to you, the biggest thing we look at is, of course, to medical professionals only. HillTop does not sell direct to the actual patient base. Everything has to go through a medical office. We never compete against our clinical partners. That's not what the business we're in for. We are looking at outcomes, and the best way to obtain that data and outcome understanding is through the actual physician's office. We get the best results through that way, and we've done this for years. We actually ended up doing this with nutritional efforts previously, now bringing this into CBD space. So we want to bring those exact programs and efforts that we've done previously that have worked so well into the CBD space so you can utilize these programs efficiently. And we look at a very simple step-to-step launch. We're not here to take up a lot of your time. These are small ancillary additives to your practice. So we are going to produce not only the protocol brochures, the signage, simple ways to speak, simple ways to get them started. Everything is drawn out to be very systematic and an easy way to launch and get patients going without encumbering the amount of time and staff, but also giving an ability and the tools to have everybody understand what they're getting into, because the dedication behind the physicians and the staff make these things successful. So we want to make sure we provide all those tools to you. So we do come up with ways of doing that through our training and support systems. We have full dedicated teams. We can have people on site, but mainly right now everything's virtual, so we can accomplish both. We do easy onboarding processes. We supply everything. We actually give everybody starting kits with brochures, signage. It's all included to ensure you have all the necessary assets to get going. And most importantly, with our our support teams, we are working with you and the staff to obtain those results that you're looking for. And then our medical advisory team, we're one of the only CBD companies not only approaching with a protocol effort within a medical space, most importantly, we have a full medical advisory. Right now, we are stacked up with 3 different physicians and more coming on board. We have a triple board cardiologist out of Arizona. We have an oncologist out of San Francisco, California. And we actually have an OBGYN that's working with us out of Indiana with Axiom Health. So we do have some very, very high level physicians that have joined us to do one thing: utilize the protocols, design them specifically to obtain patient outcomes. And they're looking at how they can make it easier within the medical space. So you as a physician or a clinical team can not only offer this, but you could offer it in a very simple process. And again, we want to look at scientific feedback, everything we can provide to you to make it easy, quick, and then also keep you at your best, especially in the industry. So we talked about some of the tools that we provide. Everything from table displays, protocol brochures, signage, product cards, we have it covered. Script pads, we got it all. All these are part of our kits that make it very simple for you to get started, and are all included actually with our programs. So we want to look at providing you as one of your clinic's #1 solutions for CBD and taking a new approach, and then looking at how we can actually improve the efforts of CBD by protocoling it out. We are changing the game in regards to CBD, and we'd love to have you a part of that. And us teaming up with Taylor Medical, Siobhan and Ashley and Dr. Krause have been unbelievable in allowing us to present this to you. But most importantly, the passion they have behind what we're trying to accomplish, which is to change the world of how CBD actually is offered within the medical space through these programs. So we are here actually part of this presentation to offer a trial to you. And I know a lot of physicians are like, look, I want to really kind of get my teeth dug into it. I really want to see how it tastes, touch, and feel it. And I want to see our outcomes. I want to get patient feedback. Well, I'm here to offer that to you today at a very easy way to get started with us at no cost, which is even better. So we are looking right now for about 10 clinical offices or 10 physicians to work with us to obtain 10 patients each to try to help obtain some data and outcomes. And it's pretty simple to do. We're going to do this with a 30-day trial. And every product we take, every program we take lasts between 10 to 30 days, which we see the outcomes. So it's pretty fast. We have actually some that are less than 10 days. But we want to run with a 30-day effort to keep consistency and then also see the outcomes at a long-term benefit, and also the returning of patients, which is big. So I want you to witness it firsthand. So I'd love for you to join us. Taylor Medical and us as HillTop are looking at joining with these physicians yourselves on looking at what we can provide you for these trials. And we want to look at the starter kits we can provide you at no cost. There's going to be a very easy patient order logistics. It's actually all done on their phone. So essentially you speak to a patient, talk to them about the protocol. We have protocol brochures you'll have on hand, why they would use it. We're going to train you on all this. And then how they get started is actually pretty simple. It's on the actual website they just buy and purchase, and it's associated to your location. Every trial patient will receive 20% off. Most products range between $59 to $89. So this is not going to break the bank. We're going to give them 20% off of that. And all our products essentially are dosed out for 1 month. Okay. And then there's no held inventory cost at this time. So we're not asking you to carry anything on site. We can drop ship everything to a patient's house. We're going to make it very, very simple. And then our teams will work with the patients and your offices to obtain start dates and then obtain and gather those results over the course of the 30 days. So our getting started kits are pretty simple. After this webinar, Ashley and Siobhan will share with you a link where you can set up a quick presentation with me to kind of go through the basics of this and get you started. So there'll be an e-form that you're going to fill out to set up your first meeting. It'll take less than 15 minutes. Once we confirm everything and we have all your information, I'm going to send out a kit to you by mail. You're going to get a little starter kit. And then once that's received, we'll conduct a quick training on just how to use everything from the protocols, script pads. I've got script cards, and we're also going to send you a sample pain spray. It's about 3 ounces that you could use on site. It has one of the best responses because all you have to do is spray it. There's no creams involved. It's one of our top products. So it makes it very easy for people to get pretty quick results right in the practice. So you can kind of move on forward with them to get them part of the trial. So that's all part of this. On the protocol brochures, we make it even easier. On the protocols on the back is a QR code. And this ends up going right to our landing pages. They can use a QR code, and we actually have dedicated URLs to make it even easier, essentially like HillTop Pain or HillTopSleep.com. That brings them right there. Your office or you as a physician will provide you a very simple coupon code that'll give them the 20% off. That's how we track that they're your patient. And then from there, we'll start tracking progress, get them started, and we'll do everything for you on your behalf. We ship the product and everything is all covered. That's all part of the program. And then our support teams, as I said, will continue to follow up with them. After the 30 days, we'll present you all the results. We've been working with you throughout that time, but essentially we'll give you the full results so you can determine, yes, you know what, this has been a great thing for my patients. I've seen the outcomes. I want to continue. I want to move forward. How would that look? Then we can go through with you on becoming a actual HillTop partner and then expanding your reach into your patient base with how we work with you on that. So we try to make it very simple and step-by-step for you. So essentially the goal is right now is it's a trial. If you do have any questions, I'm going to have Ashley kind of jump back in. I know we're going to try to see if we can get some questions answered for you. Again, the goal is to make it simple for you. And if you have any questions, go ahead and put it in the chat and we'll try to get them answered for you tonight and how you can get started with us too. So I do appreciate everybody's time on going through everything about HillTop and on how we're intending to work with you and Taylor Medical.
Thank you so much, Michael. That was really good. I think one of the main questions that we're probably going to get is CBD illegal? I think there's a generation out there that thinks that this is illegal, that if it's not approved in your state, then they would not be able to do any CBD. So can you answer that for us?
Yeah, the good news is that we are only based within hemp CBD. So hemp being more of an industrial use product and source, not cannabis and marijuana, puts us in a whole other realm. So once you're within the hemp CBD space, extracting from hemp falls under what's called the 2018 Farm Bill. That bill specifically states that now that hemp CBD derived products can be utilized within the commercial space and the medical space to be used accordingly to, especially for a physician say. Since it's hemp, the only regulation we have to follow is making sure that the THC value is 0.03%. Now, within our product line, we have what's called full spectrum or isolate. Now, isolate is going to be 0% guaranteed, especially on our certification of analysis. Meaning is that it's just the extracted CBD, it's the isolate to it, correct? Full spectrum means it's the broadening of the entire leaf of the hemp plant. And from that extraction, once we go through 5-time testing, we actually end up getting it all the way down to 0.03% or less, sometimes 0.01 to 0.02 to ensure quality control. So that is also verified through the COA. So we are not only providing certification of analysis and have an FDA facility that's doing it, our manufacturing process ensures to you that you are following federal regulation and what you're offering to your patients is protected. That's the concern about sending them somewhere else or not getting it from somewhere that is certifying it. And that's essentially where we come in play and why you would use us to ensure you follow within those laws.
So if you had a patient, for instance, that was random drug tested at work, if they were drug tested, are they going to fail a drug test because they're using CBD products?
This is a great question. You would have to consume quite a bit of the full spectrum to do that. However, that's essentially why we have some of the products, especially for oral, obviously this is the oral question, is that they fall within the isolate spectrum. So if you have patients that are concerned about that, the THC levels or they have drug testing, we would only recommend isolate products for them. That'll keep them within those safe zones.
Okay. And what about the shelf life of HillTop?
We have FDA stamped 2 years, and no product is sent to any medical office under 90 days.
Okay. And are there any side effects, good or bad?
In the market, yeah, good or bad, there is right now, there are no listed CBD, hemp CBD studies that are showing any side effects. There are some concerns with some medications. We can get you in touch with the medical boards on specific patients. There's been issues with thyroid medication concern and combinations there. But essentially, it runs just like a supplement. And what's really amazing is that the cardiologist we work with, he's a triple board, he's really interesting, and I'm sure a lot of physicians will agree, is that we do a lot of testing, independent trial testing on like a lot of supplements like vitamin C, vitamin D, and vitamin K. We know the benefits behind these, but there's been more strenuous testing on hemp CBD than most supplementation that we offer within the market, which is really amazing because that's still starting to draw out a lot more, I would say, not only studies, but comfort that's coming along with CBD and really what we can get out of it. And then those are being used within specific concerns or chronic illnesses to show outcomes. So to really kind of get down to what you're saying is, yes, we really kind of look at how it can be used and the best ways we use on a safe level, but we are not seeing any type of side effects that are of any concern. But again, we can have them addressed case by case.
Yeah, I think I speak for the whole Taylor team we've been talking about HillTop for a while because we all have used it. And we all talk to each other about how much we all loved HillTop's products. My son deals with some anxiety before surgeries. I've given it to my son before surgeries. It works. I think it's a really awesome product. That is really all the questions that I have, Michael. I would, really say to anybody that's on or listening after or now, the 30-day trial is something that I think is a really good promotion for your practice to kind of introduce your patients to this. I think it's a great way to introduce your patients. I think the marketing material that you guys have to go along with it is really nice to kind of put patients at ease when it comes to a lot of the questions that patients may have. I think we've answered a lot of those on here tonight. You did a very good job presenting a lot of the questions that I know that patients and doctors both have about CBD.
Yeah. Oh, great. Yeah. And if there are any, please let us know, and we're here to help. And again, just to get started is real simple. Just there'll be that link in that link tree that we could share out, that you could schedule just a time right with us. Literally no more than about 15 minutes to 30 minutes. We need your time just to kind of go through details on how it would work and answer any other last questions you have.
Yeah, and Siobhan put the link in the chat box for everyone, and also some protocols in there as well. So if there's any questions while you're watching, you guys feel free to click that link. I think, as far as I know, that we've run a little short tonight, which is okay. If anybody has any questions, please feel free to reach out to anyone on the Taylor team. Michael, you can reach out to HillTop. And I would like to invite you all to the next Taylor Tuesday, which is going to be August 3rd, with Swell, Growing Your Business Online and Why It's Important. I invite you all to come. Everybody go check out taylormedical.com, check out HillTop's website. And we thank you guys, as we do every couple weeks here at Taylor Medical, for joining us for Taylor Tuesday. And we'll see you guys August 3rd.
Thanks again, Ashley, for your time. And everybody, thank you. Appreciate it.
Thanks so much. Y'all have a good night.
All right, great.